name is Todd McDonald, and I am the president of Aisling Partners Insurance Brokerage, headquartered here in Worcester, Massachusetts. And I am joined by my business partner, John Clark, as well as the staff here at our firm. In addition, we are joined by our sister company in Glastonbury, Connecticut, Catalyst Employee Benefits Consulting, which is led by John Fitt. So on behalf of all of us, we'd like to welcome you this morning and thank you for participating. Before we get started, just a couple of housekeeping items to go over. Number one, if you would be kind enough just to mute your telephones and computer microphones, as they do tend to cause some feedback on the phone lines. Also, there are two ways to ask questions. If you want to simply go to the white box at the bottom of the chat box, you can click on the To box and then select To Presenters, and then hit the button with the arrow, and then it'll post your question. Or you can just simply wait till the end and ask your question then. And finally, I just want to remind everybody the takeaways for this session and the others can be downloaded on our website under Aisling University. And for those that do not have our website, it's www.aisling-partners.com. As many of you are aware, the topic we'll be reviewing today is a results-driven wellness program created by Interactive Health Solutions out of Chicago. IHS is a HIPAA-compliant turnkey health awareness and preventive care program for U.S. employers that engages employees in a comprehensive process that stresses early detection, testing, and aggressive follow-up before health problems take hold. Adding the IHS program to existing medical plans allows companies to establish a performance-based system rewarding individuals for healthy lifestyles. And today, the webinar is being presented by Sean Fitzgibbons. We're delighted to have Sean. His current role at IHS, after being there for 3 years, is the company's regional manager. He works with employer groups and brokers nationally to incorporate this performance-based program and additional strategies into the existing healthcare programs. Proven effective to combat rising healthcare costs while increasing productivity and quality in the workplace. So we're delighted to have Sean Fitzgibbons, and I'll turn it over to him.
Thanks, Todd. I appreciate that. First and foremost, want to again thank you as well as Aisling Partners for giving myself, along with Interactive Health Solutions, an opportunity to participate on today's webinar series. So thanks for that. Just as Todd had mentioned, my name is Sean Fitzgibbons with Interactive Health Solutions. We are based out of Chicago, Illinois. We have been in the health and wellness industry for 20 years now, and we have employer groups nationally located in all 50 states, groups that are fully insured, groups that are self-funded, those that may be 20,000 employee lives to groups that may be 20. At the end of the day, the conversation we like to have from a consulting standpoint on wellness initiatives with our clients is understanding the business value of health, understanding the business value of investing in the health of an employee population to very simply keep that employee population out of the hospital where they're incurring healthcare costs and in the office or the field where they're not, where they are providing better quality product or service, where they're making you as an employer more competitive in the marketplace. Ultimately, it's about generating results and trending medical spend for our employer groups, and that's really going to be the focus of today's conversation, is how do you, with wellness initiatives, generate results. And it's going to take us an opportunity here to understand the business value of doing that. But what we're trying to really accomplish and hoping to accomplish in today's webinar is having everybody understand that you need to take a strategic approach to your health plan. Have a strategic view to your health plan where you're viewing your health as an investment rather than expense. And it's about using the preventative benefit in your health plan as it was designed to engage employee populations in prevention, educating them then ultimately with tools and resources throughout the course of the year to keep that employee population not only engaged but healthy, and ultimately then giving us an opportunity through that educational process to trend the health of the population in the right direction to ultimately generate results on medical spend, impact productivity and quality, which we'll be discussing here shortly. But it is about taking a strategic approach to your health plan, and I'll be elaborating on the value and the aspect of that here in greater detail. Very briefly, just to kind of outline the agenda for today's webinar, we're going to initially talk about healthcare costs and the current state of healthcare. Why is that imperative? Because, again, we're understanding the business value of health. It's not only just utilizing wellness initiatives to trend the health of the population to offer a benefit to your employees, but it's about trending medical spend and combating increasing healthcare costs on an annual basis. In my 3 years working at IHS, when I'm talking to employer groups about healthcare costs, not one of them has told me that their medical trend is decreasing on an annual basis. So what are some opportunities out there to control healthcare costs? And we'll look at emerging health trends that are available to do that, essentially achieving goals of combating the rate of increased medical spend. And then finally looking at strategic plan design or best practices that are available with wellness initiatives that can best allow you as an employer to trend the health of the population and generate results in terms of combating medical spend. But it does all begin initially with healthcare costs and the current state of healthcare costs. And we're looking at healthcare costs without change. Per employee healthcare costs will nearly triple over the next 10 years. Now, this study is based off of a Wellness Council of America study. However you break down this study or various studies you see, essentially at the end of the day, rather than looking at the numbers of the increase, I want to focus on the trend. And the trend is always increasing in the wrong direction. And the problem is that largest portion of cost increases are associated with modifiable lifestyle-related chronic illness. So to take a step back and look at this medical trend, according to WellCOA, they're indicating that the average employee costs about $5,000 on the medical plan in 2001, and that increase is going to be close to $30,000 by 2019. And we feel at IHS that one of the reasons why this increase is so dramatic on an annual basis, it's because of us. It's because of the working employee population. It's because of the fact that 80% of the employee population nationally do not go to the doctor annually for preventative health evaluation. 80%, which means that when are people ending up in the hospital? When they're sick, when it's already too late. So what we're finding is happening is that employees are not utilizing their health plan as a health plan the way that we have designed it, but rather they're using it as a sick plan. And when that happens, ultimately, you've got current employees with health conditions or new employees with health conditions that evolve on an annual basis, ending up in the hospital with large claims that cost financially a great burden to treat. So at the end of the day, the philosophy is in order to combat that increase on an annual basis, let's educate employees and keep them healthy prior to those health conditions ultimately unfolding. We feel that there's probably two strategies available out there today that are truly viable and work to help organizations control healthcare costs. One is plan design. That's why you're working with Aislinn. You've got a fantastic broker who works with you to help modify healthcare plan design, whether it's going from name brand prescription to offering the generic because it's a cheaper alternative, or maybe being self-funded makes more sense for you than being fully insured. At the end of the day, what's happening is you have an opportunity with modifying healthcare plan design to combat or financially take the burden of medical spend off of you on an annual basis. But the reality of the situation is still all the plan design changes you make, you're still hopeful or knocking on wood, if you will, at the end of the year to have a successful increase, or I should say decrease, in medical trend on an annual basis. So we feel the other viable option or strategy available to organizations to control medical spend besides plan design is implementing a proven and effective prevention program. Again, the focus of today's conversation is using your health plan strategically, investing in the health of the population, and engaging them in preventative health to prevent medical trends from increasing on an annual basis. A positive thing is if we were to look at Hewitt Associates, this strategy of implementing a proven and effective prevention program is where the market's headed. Everyone's talking about wellness initiatives currently today. Based off of the study in front of us, 83% of employers are currently investing to improve employee health and productivity, and 90%, projected by 2015, are going to proactively invest to improve employee health. Now, my concern with that number or those statistics are that a number of these employer groups, I guarantee you, are going to offer wellness initiatives to improve employee health because it's a good benefit to provide, but are going to be struggling in terms of impacting their bottom line or actually trending medical spend and generating results. The reason why that is because there is a lot of noise in today's marketplace in the wellness community in terms of activity-based program versus results-based program. What I mean by that is majority of the time, wellness initiatives that are offered to employee populations are benefit-type focused programs that are by all means valuable, but are difficult to quantify results or actually trend the health of an employee population. There may be those of you who have joined us today who've done lunch and learns or tried to do lunch and learns in the past, or maybe you're doing walking challenges, the pedometers, or biggest loser competitions. And all of those programs are absolutely fantastic. Those help employees engage in their health and help provide them with ways and tools to manage their health, but it's difficult to truly quantify the results of doing those programs. If we were to do a lunch and learn and you had 100 employees, I imagine maybe not all 100 of them are participating. Participation is generally low with activity-based program at the same time. So it's about how do we implement performance-based programs? How do we actually reward employees not just for demonstrating they're engaged, but for actually demonstrating they're making clinical improvements to their current state of health? So not rewarding for saying that you as an employee went to the gym 3 times a week and you should be qualifying for an incentive, but demonstrating as an employee, rather, that you have managed your clinical cholesterol levels, and that's how you are able to qualify for an incentive. In order to have that be a success, that concept, 2 things need to happen with the performance-based model, with the approach that we're going to be discussing here shortly. With any wellness initiative, the first objective to happen year 1 or 2 is to get employees comfortable with the program and essentially drive participation to have success. And why is participation-based programs important? Because if you were to roll out a wellness initiative and only have 20% of your employee population participating, it's the same 20% that's probably already engaged with their health. So how is that going to impact your bottom line? So it's about driving participation initially, which we'll be discussing shortly, but then ultimately, once you do achieve and have success with high levels of participation, it's about accountability, which we have in front of us, empowering employees to take control of their health so employers can take control of their bottom line. Again, it's not just about rewarding or offering programs to employees so they can be rewarded for actually participating, but rather rewarding individuals for demonstrating they're making clinical improvements and holding employees accountable in order to do so. So what's the goal? How do we achieve this with strategic plan design? It's about creating a performance-based design with metrics that hold members accountable for getting and staying healthy. So I'll take a couple of minutes now to elaborate the philosophy and approach that we feel is the most successful from a wellness initiative standpoint to actually generate results and trend the health of the employee population in the right direction. And it starts initially with measuring the health of an employee population. And when I mean measuring, we're referring to doing so with clinical outcomes or data. So the philosophy and approach is when coming back to prevention, generally employer groups are offering or have a preventative benefit available in their health plan. We know that's offered because it's a good thing to provide. It may be required. It may be something that, again, is just positioned truly as a benefit. But the value of the prevention aspect of health is to prevent health conditions from unfolding. The problem, again, that we're seeing nationally that I already mentioned previously is that there's such a lack of utilization of the preventative benefit. So our philosophy initially is let's measure the health of the population by driving utilization of the preventative benefit. How we do that in theory at IHS is we actually have medical staff or phlebotomists that travel nationally to various locations to perform the preventative health evaluations on site. Again, it's just a philosophy of saying, okay, let's take a different strategic approach to how we're using our health plan, and if employees aren't utilizing the health plan as a health plan, but rather as a sick plan and going when it's too late, let's bring the preventative health evaluations on site. The philosophy then with that approach is that you're making it easier for employees to participate. It's more conducive. It's located right there in their office where they can have a full panel health evaluation take place at a convenient time and location for them. By being on site, what you're also being able to accomplish is having maybe the unhealthiest population who would never want to participate be involved in prevention because, again, it's located convenient for them. And the aspect of using those clinical outcomes then is, in our philosophy, testing with clinical data every organ in the body, doing as much comprehensive health evaluation lab work as possible to fully educate an employee about their current state of health, about their cholesterol levels, about their glucose levels, about their red blood cell count to prevent anemia or manage anemia, or liver conditions, kidney conditions, white blood cell count for forms of cancer. So by using a comprehensive clinical approach, you can, to the greatest extent, educate your employee population about their current state of health. When you obtain that clinical data, what you're able to do then is strategically use that data to develop wellness initiatives now for your employee population that is going to be meaningful to them because you understand what the health of your population looks like. We understand what types of wellness programs we could offer and what types of employee populations we should be targeting based off the clinical data available. When that information is obtained, we're then able to manage or help the employees manage their current state of health with tools and resources that are meaningful to them to allow them to manage their state of health and trend their current state of health in the right direction. What types of tools and resources could be available then? Anything, again, from webinars to those lunch and learns to potentially walking programs to telephonic health coaching programs. But at the end of the day, what we're advising, again, is by educating the employee initially about their state of health, it's going to want to make them more proactively participate in the activity-based programs because they understand what's appropriate for them to participate in order to manage their state of health. At the same time, then, in order to generate results, it's about rewarding the individuals for performance based on the clinical outcomes. And I'm going to elaborate on that concept here in philosophy to a greater extent in a moment. Well, we're not just rewarding individuals for actually participating in the activity-based programs, but rewarding them for improving upon the clinical outcomes or goals that we've set for individual employees. That's how we're measuring, again, with the clinical data, is because in theory what makes sense is when anybody participates in the program, regardless of their healthy or they're not, in order to generate results, it's about setting clinical goals or outcomes for employees to work towards achieving on an annual basis. Again, if they're healthy, their clinical goal would be to simply maintain healthy category or risk factors, and if they're unhealthy, it's about trending the health of that population in the right direction. Goals would be set specific to an individual based off of their age, based off of their gender, based off of their clinical outcomes. When that approach is effectively implemented then, individual employees, again, who are healthy are going to be staying there, everybody else trending in the right direction, and what you're able to accomplish then is incorporate a performance-based health plan within your organization. We are holding employees accountable for trending or hitting clinical outcomes on an annual basis. The activity-based programs help them achieve the clinical outcomes or goals that you set or reset for individual employees. You're probably thinking to yourself now, yeah, that's great in theory to say, okay, employees are going to get clinical outcomes, have goals to achieve on an annual basis, but we know participation maybe currently with an existing wellness initiative is low, so how do we get employees to participate and hold employees accountable to work towards these clinical outcomes? And it's about incentives. It's about maximizing results with incentives, and this incentive paradigm is able to essentially outline that. 8 in 10 employees currently believe that worksite wellness programs are a good idea, but 3 in 10 employees actually participate in the programs when they're offered. Employees are 2 to 4 times more likely to participate if incentives are provided. Unfortunately, we'd like to think that just by offering wellness initiatives or just by having biometric health evaluations on site, that is a good enough incentive to drive employees to participate. And I personally feel it should be at the same sense. Employees should want to participate in that benefit being offered to them by an employer. But unfortunately, statistics will consistently demonstrate that if employees do not have additional forms of incentive, we're not going to be able to generate results and the types of success that we're looking to accomplish. To talk about that to a greater extent, there was a study done by the University of Michigan that indicates if a wellness initiative is offered on a voluntary basis, employers typically get anywhere from 25 to 35% of the employee population participate. If an incentive is $100 to $400, you're going to get anywhere from 40 to 70% participation. And if an incentive is $500 or greater, you're obviously going to get 75 to close to 95% participation, because that monetary value clearly is going to drive employees to participate in the wellness initiative being offered. So what's the value, again, of maximizing results with incentives? Well, year one, it's simply participation-based. By offering a form of incentive or driving employees to participate in the program, hopefully getting 50% or greater of the employee population participating in the program, understanding with that 50% of the population participating what their individual clinical outcomes are and what the company's or your entire employee population's clinical outcomes are to develop wellness initiatives moving forward into the future. But the goal initially is utilizing incentives to drive participation, demonstrate to the employee population the benefit of the wellness initiative being offered, the value of obtaining the clinical data and information specific to their own state of health, but ultimately holding them accountable into the future as well. I'll elaborate on what that means now in terms of holding employees accountable with the incentive paradigm. To talk about just various forms of incentives, if you are currently offering wellness initiatives, there's obviously a variety of forms of incentives that can be offered to an employee. What we feel where the market is headed and probably the most effective approach to take in terms of offering forms of incentives is the premium contribution differential, meaning giving employees an opportunity to be rewarded for demonstrating they're engaged in their health, and that reward is lowering your cost share differential to a certain extent. I'll give my company, Interactive Health Solutions, an example. I'll use us as an example with this incentive paradigm is that we currently pay, if you were an employee at Interactive Health Solutions, let's say $50 a month for health insurance, or a total of $600 a year. What our employer decided to do was, based off of the increase in medical trends, offer single coverage, and across the board was additional $100 a month, or $1,200 a year on top of the $600 currently being applied to an individual. So the total that medical spend for an individual on single coverage was $1,800 a year for everybody across the board. Legally, in HIPAA-compliant fashion, we all were having an opportunity to pay the exact same in single coverage health insurance rate. However, by demonstrating that we were participating or engaged in our health, I'm able to, just simply by participating in the first year of my program, buy my premium contribution rate from that $1,800 a year back down to $600. I was able to save myself $100 a month, or $1,200 a year, by demonstrating I'm engaged in my health. What is the value of offering that type of incentive? One, it doesn't cost you as an employer anything to offer that type of incentive when you're simply raising the employee contributions. Two, it is very effective at driving participation initially when programs are implemented, because who in their right mind didn't want to save themselves $1,200 a year? So it's a very successful approach to take when offering that type of incentive. And finally, three, the value of that is, from a business perspective, any employee who simply elected not to participate in the Wellness Initiative program, they simply paid the single coverage rate that was applied or offered to every employee on a single coverage plan, but that was a higher contribution rate. they were now financially taking a burden off of the employer as well, because for them personally, they just felt that for whatever reason, it wasn't appropriate or necessary for them to need to participate in wellness initiatives. They didn't feel the need to be rewarded or buy their contribution rate back down, and they would simply pay the higher contribution. That's fine. That means they're paying additional contribution that's offsetting the burden for you as an employer. So one of the values, again, with driving participation is offering incentives, and that premium contribution approach I will consistently consult is the most effective method to do that. Now, in order to generate results, though, it's about incorporating a program that is sustainable to ensure results with that performance-based model that holds employees accountable year-round. The example I just referenced simply was indicating that if you participate in a wellness initiative program, obtain your clinical information at Interactive Health Solutions, if you were to work for us, you'd be able to save yourself $1,200 a year and simply be rewarded for the fact that you're engaged. But what happened after you participated in year one of Interactive Health Solutions is you were being rewarded moving forward for performance-based improvements, meaning every participant or employee at Interactive Health Solutions was not only given a baseline level of clinical health after they participated year one, but also a goal or a clinical outcome that they needed to achieve moving forward year two, either indicating that you're in the healthy range, the moderately unhealthy range, or the unhealthiest category. Again, your clinical goal was specifically set for you based off your current state of health. So I, in theory, Sean Fitzgibbons at IHS, could be the unhealthiest employee at Interactive Health Solutions. I was not penalized for being the unhealthiest employee. I simply participated year one in the wellness initiative being offered by my employer, and by doing so and demonstrating I'm engaged, I was able to be rewarded for that and buy my contribution rate back down $1,200 a year. However, after participating in that program year one, I was told that I'm in the unhealthiest category, have clinical outcomes and goals that I need to achieve in order to qualify for the premium contribution savings in year two, meaning I now have some skin in the game. If I want to save myself $1,200, which I'm not forced to do so, but I can be rewarded again for making improvement in managing my health, I'm probably going to want to participate and engage in my current state of health in order to qualify for that incentive. Maybe for me, because I had high cholesterol, it would be signing up for a lunch and learn program on managing cholesterol, or a webinar on managing cholesterol, or a better nutrition health coaching course. Or maybe for me, it was following up and having my results sent to my physician, so my physician would be able to prescribe me a form of statin or medication that would help me manage my cholesterol. But at the end of the day, what I'm going to be doing as an individual employee is using all the activity-based programs available in order to qualify and hit my goal and incentive because I want to save myself $1,200. What's going to allow me to do that? Obtaining clinical outcomes. What has my employer just been able to accomplish with me as the unhealthiest employee has not penalized me for that, but has now gotten me thinking, how do I manage my current state of health and my high cholesterol levels to make sure that on an annual basis I have this under control rather than ending up in the hospital with a heart attack. That performance-based model is what's going to drive the employee population to trend in the right direction from a medical health standpoint, allowing employers as a company to control or dramatically combat medical spend. This concept and approach works. We have a proof of concept, actually. It's interesting. When you look at studies on wellness initiatives, there are a number of studies, wellness initiatives, reporting in terms of what does a wellness initiative do in terms of impacting productivity or quality or workers' compensation costs or even medical spend. And what we decided to do at Interactive Health Solutions, because there are so many other studies out there that outline the value or your return on investment with wellness initiatives, we decided to be proactive and internally use our employee population and our client base to understand what does medical trend will look like for employer groups who are investing in the health of their population. So what we decided to do, we hired a third-party called Zoe Consulting. They're based out of the Carolinas, and they were hired for their credibility in terms of the fact that they've won 2 C. Everett Koop Awards for their studies and medical trend industry. So what Zoe Consulting was able to accomplish for us over a 2.5-year period of time was take 300 employer groups and 50,000 participants and trend the medical spend for those 50,000 participants and 300 employer groups over that 2.5-year period of time. What was identified over the 2.5-year period of time was that employer groups that were not offering wellness initiatives had on average a 24% increase in medical spend. Employer groups with a prevention program, a clinical-based outcome program in place, only had an 11% increase. It was greater than a 50% decrease in medical trend over a 2.5-year period of time. Now, in terms of what financially that means, that's specific to what the medical trend is or increase for you as an employer group, but that could be anywhere from saving hundreds of thousands of dollars on an annual basis to saving millions of dollars over a 2.5-year period of time. At the end of the day, what this slide is demonstrating is that, yes, medical trend is going to generally increase on an annual basis, but you as an employer, by investing in the 2 strategies available, plan design and prevention, have an opportunity to really combat that medical trend increase on an annual basis if you proactively invest in the health of the employee population, provide them with tools and resources throughout the course of the year, and reward them for clinical-based performance. To even demonstrate the value of wellness initiatives to a greater extent, if there was a disease management program incorporated on top of the proactive biometric at the front end, you're even more able to dramatically control medical spend. As a point of reference, disease management is the wellness initiative that really manages the sick individuals at the very back end of a health and wellness program, people who are maybe already engaging with their physician. So what this slide is demonstrating, again, is that if you have the front-end preventative piece in place, you're strategically using your plan the way it was designed and engaging employees in prevention to prevent them from ending up with life-threatening conditions. And you've got a disease management program on the back end managing any conditions that are already been identified. You have an opportunity to most effectively trend medical spend on an annual basis. The proven path to achieve healthier results, again, measuring the health of the employee population with clinical data and outcomes on an annual basis, managing the health of that population, providing them with tools and resources that are going to be meaningful to them based off of the current state of health identified within the clinical outcomes from your organization, and then rewarding individuals not for activity-based programs, but rewarding them for making clinical outcomes or managing their state of health on an annual basis. And when you're able to do that, that is how you're going to most effectively trend medical spend, increase productivity, quality, offset workers' compensation costs that are affiliated with symptoms that lead to accident or injury, and most importantly, be more competitive in the marketplace by providing a better quality product or service, and based on the fact that you are trending medical spend far beyond other groups that aren't being, or competitors that aren't being proactive. That is really the ultimate goal with the business value of health, is investing in employees to ultimately be more competitive in the marketplace and generating results. At that point, Todd, if there's any questions specific to conceptually what we're trying to accomplish in more specific detail in terms of how it is accomplished, I'd be happy to answer any questions that are available.
Great, John. Thank you. I don't see any questions up on the site at this point, but does anyone have a question they'd like to ask? Okay, I think we have a quiet crowd. Again, I want to thank Sean for putting this together and for the presentation. We really appreciate it. I'd also like to thank all of the participants today. Hopefully you found this helpful in terms of the option for wellness and the ability to be able to provide a program that's results-driven, measured, managed, reward type mentality. In addition, I'd also like to take the opportunity to just remind everyone you can certainly download this presentation as well as others on our website. So if you were not able to attend or like to have another colleague share the presentation, please know that you can certainly do that on our website. In addition, while you're out there, we just would like to remind everyone that our next webinar is on June the 14th at 11 a.m. And this webinar will be about consumer-driven healthcare, high-deductible plans, health reimbursement accounts, as well as health savings accounts, and how they work and how they can possibly work for each of you. So again, Sean, thank you very much, and thank you to IHS and for all the participants today. And as always, we would certainly welcome any feedback that could help us improve the deliverables on these webinars each month. Thank you.